Pyelonephritis is inflammation of the kidney, typically due to a bacterial infection. Symptoms most often include fever and flank tenderness. Other symptoms may include nausea, burning with urination, and frequent urination. Complications may include pus around the kidney, sepsis, or kidney failure. Pyelonephritis is a bacterial infection of the kidneys, part of the upper urinary tract. It typically starts as a urinary tract infection (UTI) in the bladder and then spreads upwards to one or both kidneys. 2. Causes. The most common cause is bacterial infection, especially E. coli accounts for approximately 80 to 90% of cases. Other bacteria, Klebsiella, Proteus, Enterococcus. How bacteria reach the kidneys. Ascending infection from the urethra gives bladder, gives ureters, gives kidneys. Hematogenous spread less common, from bloodstream in septicemia or infective endocarditis. 3. Risk factors. Certain conditions make someone more prone to pyelonephritis. General risk factors. Female gender, shorter urethra. Frequent UTIs. Sexual activity. Poor hygiene. Medical conditions. Urinary tract obstruction, for example, kidney stones, enlarged prostate. Vesicoureteral reflux or backflow of urine from bladder to kidneys. Diabetes mellitus. Weakened immune system. Pregnancy. Procedures. Devices. Urinary catheterization. Recent urinary surgery. 4. Signs and symptoms. Classic symptoms. High fever with chills. Flank or back pain, usually one-sided. Nausea and vomiting. Burning during urination. Frequent or urgent urination. Cloudy, foul-smelling, or bloody urine. In elderly or immunocompromised individuals. Symptoms can be vague confusion, weakness. 5. Diagnosis. Clinical evaluation. History plus physical exam, especially costovertebral angle tenderness. Laboratory tests. Laboratory examination. Analysis of the urine may show signs of urinary tract infection, specifically, the presence of nitrite and white blood cells on a urine test. Strip in patients with typical symptoms are sufficient for the diagnosis of pyelonephritis and are an indication for empirical treatment. Blood tests such as a complete blood count may show neutrophilia, microbiological culture of the urine, with or without blood cultures, and antibiotic. Sensitivity testing are useful for establishing a formal diagnosis and are considered mandatory. CT scan detect complications like emphysematous pyelonephritis, abscess, or obstruction. 6. Complications if untreated. Sepsis, renal abscess, acute kidney injury, chronic kidney damage, recurrent infections. 7. Treatment. Management. In people suspected of having pyelonephritis, a urine culture and antibiotic sensitivity test is performed, so therapy can eventually be tailored on the basis of the infecting organism. As most cases of pyelonephritis are due to bacterial infections, antibiotics are the mainstay of treatment. The choice of antibiotic depends on the species and antibiotic sensitivity, profile of the infecting organism, and may include fluoroquinolones, cephalosporins, aminoglycosides, or trimethoprim sulfamethoxyl, either alone or in combination. Uncomplicated cases, oral antibiotics for 7 to 14 days, for example, ciprofloxacin, trimethoprim sulfamethoxyl, adequate hydration, follow-up urine culture. Complicated or severe cases, hospitalization. For antibiotics, for example, ceftriaxone, piperacillin, tazobactam, treat underlying cause, for example, remove obstruction or catheter, surgery or intervention. For abscess drainage, removing obstruction or correcting anatomical problems. 8. Prevention. Stay hydrated. Urinate regularly and after sex. Good hygiene, wipe front to back. Avoid unnecessary catheter use. Manage chronic conditions like diabetes. Prophylactic antibiotics in recurrent cases as per doctor's advice. A person whose symptoms are not improving or who has more severe symptoms may require treatment in the hospital. Some people may need intravenous antibiotic treatment through a vein in their arm. If a person experiences dehydration, fluids may be administered with a drip. According to the NHS, people will stay in the hospital for 3 to 7 days.